Welcome to today's HealthLine webinar from the American Association of Kidney Patients, titled Advancing Kidney Care for Veterans. Thank you for joining us. My name is Jerome Bailey, and I serve as AAKP's Director of Patient Engagement and Advocacy. This conversation comes at a meaningful time. Earlier this month, the nation observed Veterans Day, a reminder of the service and sacrifice of millions of veterans and the responsibility we all share to support their health and well-being. At AAKP, veterans and active duty service members make up a significant part of our community, representing every branch of armed services and every generation of military service. Veterans are also disproportionately affected by chronic kidney disease, with rates estimated to be 34% higher than the general population. As the oldest and largest fully independent patient-led kidney patient organization in the U.S., AAKP is proud to host our webinar series as a service to our fellow kidney patients, family members, and care partners, healthcare professionals, researchers, and policymakers. AAKP's HealthLine and HealthLine Innovator webinars fall under our Center for Patient Research and Education. We believe patient and care partner education is an integral part of an individual's treatment, and to that end, AAKP is a champion for full patient care choice, the protection of the patient-doctor relationship, and the elimination of artificial barriers and government determinants of health that impede patient care choice and access to FDA-approved treatment options. To open today's program, it's my pleasure to introduce AAKP's President and Chair of AAKP's Veterans Health Initiative, Edward Hickey. Ed is not only a kidney patient, but also a seasoned advocate and caregiver. He brings extensive experience from both military and public service, having served as a U.S. Marine Corps infantry officer and in senior roles on Capitol Hill and in the White House. Ed is from a family steeped in uniform service and respect for veterans. Ed, I'll turn things over to you.
Thanks very much, Jerome, and welcome everyone. As a veteran and a kidney patient, this webinar is deeply personal to me, as approximately 1 in 6 veterans have kidney disease. This disease threatens not only lives, but also livelihoods and financial security. For too many, navigating healthcare, whether inside the VA or through civilian providers, can feel like a mission in and of itself that requires vigilance to gain access to quality care and the freedom to choose treatments that best align with your individual health goals, aspirations, and personal dignity. In 2017, recognizing the growing number of veterans silently struggling with kidney disease, AAKP launched its Veterans Health Initiative, an effort that I am proud to chair. The goal is clear: to elevate the voice of veterans, protect their right to timely and effective care, and ensure that they benefit from the latest innovations in biologics, diagnostics, devices, and treatment options. Veterans have earned these rights not as favors or political gestures, but through service, sacrifice, and the legal benefits they are entitled to under federal law. The Veterans Health Initiative is more than an advocacy effort. It is a mission of accountability and innovation. We push for policies that respect patient choice and clinical freedom, and we champion research that includes veterans as active, respected stakeholders. Whether a veteran receives care through the VA medical system or chooses to seek care in the community, AAKP stands firm in ensuring no veteran is forced into a one-size-fits-all model of care. We're also very deeply committed to listening and gathering qualitative insights on the patient experience within the VA system and providing those insights to VA leadership for their ongoing efforts to improve services in the VA patient experience. In 2023, AAKP entered into a formal partnership with the Department of Veterans Affairs through the Veteran Health Administration's National Center for Healthcare Advancement and Partnerships. Over the course of this partnership, AAKP and the VA have shared a mission of improving outcomes and quality of life for veterans with kidney disease and ensuring that they have access to the best research in kidney care innovations available. Through this partnership, we at AAKP have made certain issues related to expanded chronic kidney disease education, transplant readiness, and new technologies, including phosphate lowering therapies and technologies that limit catheter-related bloodstream infections are central in our discussions on how to improve veteran care. AAKP was also proud to recognize the Veterans Health Administration Kidney Medicine Program with its National Patient Engagement and Advocacy Award in 2024. To begin today's program, I'd like to introduce AAKP's Vice President and Chair of Policy and Global Affairs, Paul Conway. Paul is from a veteran family and is a passionate advocate for patient-centered care, patient participation in true shared decision-making, and the use of patient insights in kidney research. Is a kidney disease patient himself for 48 years and a 28-year transplant recipient. He has been recognized for his advocacy work with several national awards and was selected by the FDA to serve as the inaugural chair of their Patient Engagement Advisory Committee. Through AAKP's Center for Patient Research and Education, we conducted an independent flash survey in advance of today's webinar to get insights into people's understanding of the services provided by the VA Kidney Medicine Program. Paul is here to share the results from the flash survey. Paul?
Thank you very much, Ed, and thank you for your leadership of the Veterans Health Initiative. It's a rare partnership that we have with the VA, and VA's candor in approaching us and working with us to gain the insights of veterans and caregivers and incorporate those insights into quality improvements in their program is absolutely exceptional. It's in that spirit that we'll go through some of the flash survey results here, and then we'll hear from our speakers from VA and how they incorporate your insights into their programming to make certain that kidney health is priority number one for our veterans. We asked for those who were taking the survey, how many were veterans receiving care, how many were a care partner in terms of answers. You can see 68% of those who participated in the survey were veterans themselves, and about 32% were family members or care partners. We wanted to see where the spread was across the different branches, and you can see here the Army dominated, followed by the Marine Corps. Sorry, Ed. But you can see it's very representative in terms of the reach that we had on this survey. We asked where people primarily receive their kidney care. Within a VA facility, 45%, through VA community care, non-VA provider, 34%, and those who use both providers, 20%, completely outside the VA system, about 1%. We asked if folks were provided information or education in terms of nutrition, diet, lifestyle changes, or new therapeutics geared towards slowing the progression of kidney disease, and what were their experiences with that. Here you have about 38% said that they did get helpful information in the top tiers. Those who indicated no, not really, or they couldn't recall it, about 38%, or no, not at all, 23%. When you look at these numbers, this is again why a partnership with an organization like AAKP and the VA is vitally important, because we can engage patients just as VA does and educate them on what the services are the VA offers and what in particular they can do about slowing the progression of kidney disease through VA programs. We're very focused on those who have not had full education. We asked, how do you feel about your VA care team coordinating in terms of care across other health needs, in terms of diabetes and hypertension? The VA has put a heavy emphasis on making certain that kidney care is not siloed. You can see 44% said very well, 38% said somewhat well. That puts you well over 80% in terms of good experience. Not very well, 9%, or not at all, not really recalling, 9%. We asked how satisfied folks were with the quality of dialysis care through the VA or through VA community care. Very satisfied, 31%, satisfied, 31%, neutral, about 23%. In terms of dissatisfied or very dissatisfied, 7% and 7%. So well over 60% are satisfied with their care in terms of dialysis through VA or through VA community care. We wanted to find out how much education and how much of an approach folks had from their care teams in terms of vascular access options, be that a fistula, graft, or catheter. 43% said it was very thorough in terms of the discussion. 28% said they had had a discussion, but perhaps not in as much detail. And less than 30% said, no, not really. But when you take a look at these numbers, you can see a level of engagement over 70% in terms of what people's options are for vascular access, which we think is very good. Again, we're very focused on those who have not had enough education and what we can do as a partner organization with VA to continue those education engagements and make certain people know what their options are. We asked if folks use or have used a catheter for dialysis, how satisfied they were in terms of the care and infection prevention measures provided. This was an interesting slide to us. You had 11% that were very satisfied, 16% that were somewhat satisfied, and then in terms of neutral, about 0.75%. This was interesting to us because it's an opportunity perhaps to educate folks on what their other options are for catheter and infection prevention. You can see no one on our survey indicated dissatisfied or very dissatisfied. We asked whether or not the VA team has raised to you the option of a kidney transplant as a treatment option with VA care. You can see 57% said yes, 43% said no. We do believe that the no here, the 43%, is an opportunity for education, which we'll hear from our VA team how much they prioritize transplant, which is distinct. We asked in terms of overall, how would you rate VA support and information during the transplant evaluation process? 30% said excellent, another 7% said good, about 40% said fair, only about 25% said poor. This is important to take a look at in terms of those who are engaged on the transplant journey. How much are they being exposed to the education, how much engagement? And overall, we thought this was a very good picture, especially as VA continues to emphasize transplant first for those who are eligible. They've done an outstanding job on that. We asked overall in terms of rating experience with VA kidney services, where did it stack up? You can see here, 25% said excellent, 15% said good, 25% said fair, poor, 35%. When we take a look at this, it's important. These are large programs, they're complex, but you have well over 50% or 60% of the folks saying that their experience is running fair to excellent. Those are opportunities for further education, as well as those who may be slightly disconnected from the education exposure. And this was a final question that we asked, and it's no surprise to us on this. We asked that the VA kidney program offered an opportunity to veterans in a kidney-related research study aimed at improving care for the next generation of veterans or advancing kidney science as an innovation. Would you be interested in participating? Over 65% said yes, only 35% said no. In our past experience with government programs and with private sector, sometimes that no will go down much further with a little bit more education. Finally, here in a wrap, it's very important to point this out. The veterans community is quite distinct. They have served the nation, they've put it all on the line, and they're candid in their opinions. It's no surprise to us that those who have served the country before would want to serve others. We think there's a tremendous opportunity to increase research opportunities through the VA. AAKP is quite committed to it. Ed Hickey, as chair of the Veterans Health Initiative, has spent hours on Capitol Hill fighting for greater opportunities for research dollars for VA and for veterans. We support those same efforts and obviously the enrollment of veterans in the private sector clinical studies that are done by pharmaceutical companies. With that gives you a picture of who our audience was going into this and some of their insights. And I'll turn it back over to you, and thank you again for the opportunity to provide some of these insights for our audience.
Thank you, Paul, and thank you again to everyone who participated in the Flash survey. We appreciate your honesty and your willingness to share your experiences. And now for our first speaker. Joining us is Dr. Paul Palevsky. Dr. Palevsky is Deputy National Program Executive Director of the VHA Kidney Medicine Program and Chief of the Kidney Medicine Section at the VA Pittsburgh Healthcare System. He's also a great friend of AAKP's. In addition, he's a professor of medicine, critical care medicine, and clinical and translational science at the University of Pittsburgh School of Medicine and president-elect of the National Kidney Foundation. An active lifetime member of AAKP, Dr. Palevsky has devoted his career to advancing kidney care for veterans nationwide. His research in acute kidney injury and critical nephrology has produced over 250 publications, and his leadership has shaped education, treatment, and advocacy within the kidney community. Recognized for his patient-first approach, he continues to influence national policy and clinical practice, particularly in improving access to kidney transplant care for veterans. Dr. Palevsky, I turn the program over to you.
Thank you, Ed. Thank you, Paul and Jerome. It is a delight to be here. And I want to thank AAKP for their strong support uh, for the VA kidney medicine program. My goal in my remarks is to really spell out what the scope of the kidney medicine program at the VA is and provide some data on the care that we are providing. So, a little bit about the organization within the VA. The focus for the kidney medicine program is on our patient population, veterans with kidney disease, with the care being provided not only by kidney medicine providers, but by primary care providers and by other specialties, particularly endocrinology, cardiology, vascular surgery, and our transplant surgery colleagues. Sitting above all of this, in the clinical programs office is the kidney program office. We're a relatively small office of clinicians who provide part-time administrative oversight over the entire kidney medicine program. And we sit within the specialty care program office. And our goal is to optimize the health and well-being of veterans with kidney disease and to keep veterans who are at risk from kidney disease from progressing to kidney disease. Our strategic goals are to optimize access, quality, and equity of kidney care, to make sure that the care that is provided, the care systems, are as resilient as possible, particularly in dealing with natural disasters such as hurricanes and the like that will periodically impede our ability to deliver routine care, and to maintain the system as a learning healthcare system that embeds both quality improvement and research within the structure of kidney medicine care. The scope of the program is broad, ranging from early kidney disease detection and management through the management of advanced kidney disease for patients on dialysis, requiring a transplant, or opting for conservative or palliative management. A large portion of our focus is on CKD detection and management. As Ed detailed, kidney disease is more prevalent within the veteran population, but unfortunately, as in the general population, large swaths of of our veterans who have kidney disease are unaware of their kidney disease, and we need to identify patients with kidney disease as early as possible so that interventions can be provided to slow progression and prevent progression to advanced disease. We also obviously focus on the specifics of kidney disease, management of glomerular diseases such as IgA nephropathy and focal and segmental glomerulosclerosis, treatment of genetic kidney diseases, including Alport syndrome and polycystic kidney disease, management of acute kidney injury, treatment of the myriad of fluid and electrolyte disorders that patients with kidney disease or with other severe illnesses may develop, the management of complex hypertension, the management of kidney stones for prevention of recurrence of stones in a burgeoning area within nephrology that we include within the VA kidney medicine program, onconephrology, which is treating the intersection of kidney disease and the treatment of malignancies, and then for the management of advanced kidney disease, providing and overseeing in-center hemodialysis, home dialysis, including home hemo and home peritoneal dialysis, transplantation, where the VA has its own transplant programs, and for patients who choose less aggressive care, to provide conservative symptom-focused management and palliative management. One of the things that I would like to highlight is the emphasis that we've placed on early detection of kidney disease and early treatment of kidney disease. And we're very proud that earlier this year, in collaboration with the Department of Defense, we published the 5th iteration of a clinical practice guideline on the management of chronic kidney disease. And in this iteration, we have refocused the guideline on the management of chronic kidney disease in the primary care setting, beginning with the need for identification, screening high-risk patients for kidney disease, and ensuring that individuals identified as having kidney disease are initiated on treatment to prevent the progression. Along with the VA DoD guideline, we issued a directive, so a policy across the entire enterprise. Unfortunately, the timing of this directive's initial issuance led to it not receiving the attention that one would have liked, since it came out March 17th, 2020. And as many of you remember, the official date for the onset of the pandemic was March 13th of 2020. But this was a directive focused on chronic kidney disease prevention, early recognition, and management. We're probably the first healthcare system that instituted a policy such as this. And the directive established policies to improve prevention, early recognition, and management of chronic kidney disease, and strengthen the collaboration between primary care and the kidney disease program. The key requirements under this directive, which is in the process of undergoing a revision, is to implement a kidney disease program into the existing patient-aligned care teams in primary care, to establish care coordination between primary care and nephrology, to ensure that patients at risk for kidney disease are evaluated with both testing for serum creatinine and eGFR and for the presence of albuminuria, to use VA-developed reports for identification of patients at risk and to drive improvements in CKD care through a variety of clinical dashboards, to implement patient education in primary care, leveraging VA-developed virtual learning tools, although from the survey I can see that we still have quite a ways to go there, to implement the clinical practice guidelines, and to establish telenephrology and virtual care services to reach out to places that don't have specialist kidney care readily available. As part of the CARE campaign, we've been working with primary care and the informaticists to optimize the structures supporting the care of patients, and this includes developing electronic health record reminders for such things as cystatin C testing, reminders for the testing needed for the HEDIS kidney health evaluation for patients with diabetes measure, to include reminders for kidney function testing as part of the hypertension reminder for individuals whose blood pressure is inadequately controlled, to include a variety of supports within the EHR. There's a utility called the Clinical Decision Support Console, and one of the most important is inclusion of a calculator for the kidney failure risk equation to make it as easy as possible for providers to understand the risk of patients, of veterans progressing to kidney failure, to standardize the consult evaluation template, both for ordering consults and for responding to those consults, creating a dashboard for primary care providers to assist with panel management, and developing a variety of education campaigns for providers about CKD, particularly now that we have seen a flurry of new treatments that we need to be using in the early management of CKD. And one of our colleagues in primary care actually came up with this nice mnemonic for the management of kidney disease: can save, we can save kidneys, control hypertension and diabetes, assess for volume overload, avoid nephrotoxins, treat with SGLT2 inhibitors, treat with maximal dose of ACE inhibitors or angiotensin receptor blockers, vaccinate, and education on sick day rules for patients with CKD to hold medications in the setting of acute illness to prevent development of AKI. I made reference to the fact that VHA Directive 1053 has a strong emphasis on the need for telehealth and virtual care, and that's driven by our recognition that there are large portions of the country, particularly in rural areas, in Middle America, in the Rocky Mountain states, but also in the rural areas in other areas of the country, where there are essentially nephrology deserts, where there are inadequate nephrology practitioners to meet the needs of our veteran population. So the VA, in one of its innovations, has set up a telenephrology hub and spoke network with hubs at sites that have adequate nephrology staffing, such as in New England, in Indiana, at a site in Arkansas and in California, that serve as hubs to provide virtual care to VAs where there is a lack of that nephrology service. So rural VAs in New England, which was the start of the program, but now spread across the entire country. And we provide a substantial number of virtual consults that started for outpatient care and is spreading to inpatient nephrology care as well. Now, one of the things that the VA is very proud of is our history in the chronic dialysis program. VA established chronic dialysis before the Medicare benefit. For example, in Pittsburgh, where I'm based, our dialysis program dates back to the mid to late 1960s. There are slightly more than 70 VA dialysis programs across the nation, but as you can see, the dialysis units here shown with purple dots, you can see that there are large areas of the country that are without VA-based dialysis programs. So in areas that are removed from close proximity to the VA programs, VA dialysis programs, we rely on community care using the dialysis units within the community to provide the care to veterans with kidney failure. And this just shows the volume of the dialysis care over the last almost decade and a half. And you can see the tremendous increase that has developed in both acute dialysis care and chronic outpatient dialysis care, and a much smaller growth, but a tripling in the number of veterans receiving home dialysis. This focuses on the acute dialysis. The blue bars are VA delivered care. The pink bars are community delivered care, and you can see the growth in care that has developed over time here. But more importantly are the data on chronic outpatient dialysis, where you can see that we are providing care to just under 25,000 veterans with kidney failure. And our estimate is that is approximately half of the total veteran population requiring dialysis. Of those veterans, a little over 5,000 are receiving care within the intramural program, and about 18,500 receiving care through community care. One of our areas of emphasis has been on growing of the availability of home dialysis and utilization of home dialysis for veterans. And you can see the growth over time with the tripling from less than 600 veterans in fiscal year 2011 to over 1,800 veterans on home dialysis in 2024. Although this still represents only a tiny percentage of the total number of veterans on chronic dialysis, and we feel that we can do much better. And there are a number of initiatives underway to increase home dialysis availability and utilization across VA. VA is also proud of the fact that we have our own in-house transplant programs. There are 10 centers, I had to count them up, providing transplant across the VA, although the Birmingham Center is going to be shutting down, transferring their patients to University of Alabama, Birmingham's program. But we have programs in Bronx, in Hines, which is just outside of Chicago, Houston, Nashville, Iowa City, Pittsburgh, Portland, and Washington, D.C. We received just under 2,000 referrals between April of 2024 and March of 2025. Of these, slightly more than 1,300 veterans were evaluated, and slightly more than 800 were listed for transplant. And during that time, VA performed just under 300 total transplants, with 27 living donor transplants. Quality of care is important. And I talked about screening. When we look at screening for kidney disease among veterans with diabetes, GFR screening is well done, with almost 90% of veterans having an eGFR tested within the past 12 months. Not quite as good performance in terms of urine albumin screening. The numbers have been generally up to the 50 to 60% range, which still is much better than in the private sector. Blood pressure control. This is a relatively modest bar of blood pressure of less than 140/90. We really want our patients to have blood pressures of less than 130/80, but nearly 3/4 of individuals with chronic kidney disease have achieved this level of blood pressure control. When we look at the use of SGLT2 inhibitors in patients with stage 3 and 4 CKD, we've seen a steady rise over the past several years, up to nearly 40%. And while this may not seem like tremendous accomplishment, when you look in the private sector, less than 15% of individuals with stage 3 CKD and less than 10% with stage 4 CKD were on SGLT2 inhibitors, according to the 2025 United States Renal Data System Annual Data Report. Catheter use for patients on dialysis is a challenge for us. Many of our patients, many of the veterans with advanced kidney disease have a disproportionate burden of vascular disease, making it difficult to place a permanent access. You can see the data here showing that as of calendar year 24, we really are struggling to keep the catheter rate down, and in fact, the rate has been over 25%, which we don't feel is satisfactory, and we have initiatives to try to achieve better catheter rates across the enterprise. Despite the high catheter rate, though, I think we've done very well at preventing bloodstream infections. This is the data from calendar year 2021 through 2024, and we now have a rate which is approaching zero 0.5 bloodstream infections per 100 patient months, which is the target that has been set. I want to say a few words about research within the VA, kidney-focused research. The VA has a long track record of research in kidney disease, particularly seminal clinical trials, starting with important hypertension studies that were done in the 1950s and 1960s, setting the bar on treatment of hypertension, studies on vascular access and erythropoietin use that had been led by the late Jim Kaufman, and more recently, seminal studies on management of acute dialysis, use of dual blockade of the renin-angiotensin system, and prevention of contrast-associated nephropathy, and an ongoing clinical trial of pentoxifillin for slowing the progression of diabetic kidney disease. And you can see that the VA is now spending upwards of $26 million, or spent in fiscal year 24, in support of kidney research. One of the major VA kidney research programs, and one that I would encourage all of you to participate in, is the Million Veteran Program. This is a program designed to look at the relationship between genes, lifestyle, military and civilian exposures on health and illness. Since its launch almost 15 years ago, over 1 million veterans have joined this. This is actually the largest program looking at genetics and health in the United States. And the data from the Million Veteran Program has been used to understand key features in diabetes and hypertension and the role of in kidney disease among veterans. And finally, I want to end my comments by again thanking AAKP and AAKP's Veterans Health Initiative for the wonderful support that you provide. We have an official collaboration between the kidney program and AAKP, and this is an extremely important collaboration. So with that, I thank you and turn the podium back over to Ed Hickey.
Thank you, Dr. Pilevsky, for the informative presentation and the surprise picture at the end. Wow. I flashback to my son's graduation from West Point. As people registered for today's program, they were permitted to submit questions for our speakers. And I have a few of those questions for you, and I would like to present a couple of them to you. The first question is, many veterans struggle with mismatched medication lists between the VA and their dialysis center. What steps is the VA kidney medicine taking to improve how these systems share and reconcile medication information, and how is the VA making it easier for veterans to get the medications their care teams recommend?
So this is a particular area of concern for us. It's really not an issue for veterans who are dialyzing in the intramural program with a unified electronic health record. Um, uh, Primary care providers and nephrology providers are looking at the same record. So there really is very little problem there. The challenge comes when we have individuals, and as I pointed out, over 18,000 veterans dialyzing in community dialysis units, where we don't have ready ability to see the medical record. As with non-veterans, patients dialyzing using Medicare or their private insurance, the key responsibility actually rests with the dialysis provider and the nephrologist in the dialysis unit, who the VA is contracting with to ensure medication reconciliation occurs. Um, uh, in addition, um, we have been focused on making sure that the primary care providers understand how to communicate with the dialysis vendors, be it DaVita or Fresenius or the smaller dialysis chains. Through the EHR, we can often, but not always, see the dialysis records and the medication records that are there. We are trying to ensure that moving forward, that all of the dialysis chains are participating in electronic health exchanges so that their records are readily available within the VA. And then there are initiatives. For example, locally in Pittsburgh, we have tried consolidating as many of the veterans who are on dialysis as possible in a single primary care team that collaborates closely with the kidney medicine program, and which is led by a primary care provider, a nurse practitioner, who before she became a primary care nurse practitioner was a dialysis nurse, understands dialysis, and the team has been trained so that they are continuously reaching out to the dialysis units to find out what medicines they're on to keep the medicine record aligned. Now, the question of access to medications, there are a couple key points that need to be understood. For dialysis-related medications, just as they are included in the Medicare bundle, they are included in the payment bundle that the VA has with the dialysis unit. So a medicine such as cinacalcet or the phosphate binders is supposed to be provided through the dialysis facility. For patients not on dialysis or requiring non-dialysis related medications, if they have a VA contracted provider, so someone under community care, they actually have the ability to provide the prescription directly to the VA for the VA to fill that prescription. Now, the VA, like other insurance plans, often has a limited pharmacy using the medication within a class that they are able to negotiate the best price for. So, for example, there is a preferred SGLT2 inhibitor given the pricing that the VA is able to achieve. However, if there is a need for a medicine there that is not on the formulary, there is a mechanism for obtaining a waiver.
I see. So thank you very much for that. That clarifies a lot of the questions that I think we had. And actually, that area we received a significant response from our members. Next question is for other veterans on dialysis or even within the VA system or outside the VA system, limiting the risk for a catheter-related bloodstream infection remains a key priority. And really anyone on dialysis. Can you tell us how the VA monitors infection rates nationally and within certain centers? And how are new technologies made available to veterans on dialysis to limit the risk for CRBSIs?
So, we obviously are very concerned about catheter infections or any other infectious complications that patients on dialysis are at risk for. The VA has been a long-term participant, collaborator with CDC's Making Dialysis Safer initiative for reducing catheter infections. We've endorsed initiatives such as the Scrub the Hub program for ensuring the safest connection for catheters. Obviously, the best way to eliminate catheter-related infections is to eliminate catheters. As I mentioned, we have a particular challenge because so many of our veterans have come to us after they've been on dialysis for a while and have lost opportunities for vascular access in many cases. So we end up relying on catheters as the access of last resort. Our goal is to get catheters out. We monitor catheter rates, but as I showed in the data that I presented, we are not doing anywhere near as well as I would like to see. With regard to the catheter infections themselves, we monitor this on a monthly dashboard. It is the expectation that each of the VA dialysis programs is looking at that data as part of their ongoing quality assurance and performance improvement plans. Programs, and we actually have facilities address their quality improvement plan if they are outliers compared to the VA more generally. In terms of access to technologies for preventing catheter infection, these are available. The newer formulations as packing solutions for catheters to reduce infections, the antibiotic or antiseptic caps that can be used on catheters, those are all available within the VA. Each VA may have a program at the discretion of the nephrologist within each center uses the technology that they feel is most appropriate for their patients.
That's wonderful. Thank you, Doctor. And one final question is, what is the VA doing to evaluate and adopt new innovations in kidney care, such as home monitoring tools, artificial intelligence, or emerging dialysis and transplant technologies? And how can veterans expect these advancements to reach them?
we want to be at the cutting edge with the rest of kidney care in the United States. With regard to innovations in home monitoring and techniques like that, the VA has a history of um, using patient-reported data from home blood pressure monitoring, glucose monitoring, um, uh, newer techniques for home monitoring are continuously being evaluated. When we jump to, techniques for monitoring in, let's say, home dialysis techniques, our challenge is a technological issue, in that the companies that make these monitoring tools do need to be compliant with federal data security. So sometimes that has been a challenge for us.
I want to thank Ed Hickey, our president, and Dr. Poliski for that very interesting conversation. So now it's my pleasure to welcome Gateline Gatney to the program, better known as Candy. Candy is a member of the AAKP National Board of Directors, an AAKP ambassador, a kidney transplant recipient, and a Navy veteran. The former hospital corpsman developed end-stage kidney disease in 2017. She began dialysis and later received a kidney transplant. Candy also cared for her late husband, a fellow veteran, and with complex service-related health conditions. Her experiences as both a patient and caregiver drive her commitment to helping others navigate kidney disease and the VA system with confidence and support. Candy, welcome to the program.
Thank you, Jerome.
So first question for you. How did your time in the Navy shape the way you approach your kidney health, treatment decisions, or self-advocacy?
Well, as a hospital corpsman, I knew medicine pretty well, being that's what I did. And so I knew the right questions to ask and knew what the lab results meant once I was diagnosed with kidney failure. I happen to have several reasons why I probably developed kidney failure, with the nail in the coffin being acute kidney injury due to a antibiotic reaction, and that sort of, like I said, sealed my fate. And I knew what to expect when the doctor came in with the numbers. I knew it wasn't good, and I knew how to handle it. In advocacy, my knowledge again of the medical system helps me advocate for patients between their doctors and themselves, because I can take what excellent doctors like Dr. Pileski and says to his patients and make it a little more understandable. Sometimes people don't know doctor speak and they don't know the right questions to ask. And that's where I come in as an advocate.
Yeah. As a veteran, what has your experience been like working, within the VA for kidney care and transplant related needs?
Well, I haven't had a whole lot of experience in the VA system. My husband, however, was 100% disabled. So he went out to community care. I don't have a rating yet. I'm trying to get a rating. But I anticipate that I'll continue on in community care once I do have that rating, because I don't think I'll be 100% disabled. Once you're 100% disabled, you automatically go into the VA system and they provide your care.
What should veterans know about advocating for timely referrals, authorizations and communication when they're moving between VA and non-VA transplant teams?
What they need to know is that they can get a hold of their team, whichever team it is, and ask questions. They need to know their lab results, and they need to keep probably a copy of those with them so they can hand deliver them. Like Dr. Pileski said, EMRs don't talk to one another yet. VA and DoD are the benchmark, and we hope to see that rolled out into the rest of the community where all health records can talk to one another. That's the goal. But unfortunately, right now, they don't. So I would recommend that somebody be able to get care in some place that has a good relationship with the VA facility closest to them and with whatever health system they are using.
Do you know of any VA resources or programs, that you didn't know about before when your husband was alive, that you now consider essential?
Well, a lot of the things that I really didn't know about were the things that you can go to the VA for and ask questions of. And you don't have to be rated disabled to do that. You can go into a VA health facility, and they have patient advocates right there in the facility that can steer you in the direction to get a veteran's ID card and what services may be available. Say prescription drugs. You might be able to get them much less expensively through the VA system than you can through your regular pharmacy program. So those are things that every veteran should check into. It doesn't hurt to ask.
What do you think veterans need most from the VA during the transition from dialysis to transplant follow-up care?
I think one of the things they need to know is education on what the waiting list is, how to go out and find a living donor. Another group that AAKP partners with is Dove Transplant Organization. And what Dove specifically does is help living donors and vets match up. So that they can have a better chance. There's a lot of altruistic living donors out there. My daughter is one. And there's a lot of people that just want to give back to a vet. And it's a great way to partner those matches up. They've only been around for about 4 years. And they've already had, I believe, 78 transplants. And I even found some old shipmates of mine on their website when I went and was finding out about the issues.
Thank you for bringing up our partnership with Dove. It's such a great organization. Last question for you. What guidance would you give to other veterans who are just starting their kidney disease journey or considering a transplant?
I would say to start early. I would really like to see that they start screening actually while on active duty still. That way they would have a good mindset to take into the VA when they go in, and the VA would be able to use all those educational things and all those diet and all those medications and all those kind of things, could start them at the earliest possible time, because most people don't find out that they have CKD until they're stage 3 or stage 4. Then it's too late for a lot of those preventative measures that could keep them out of the transplant system.
Thank you, Candy. We appreciate you sharing part of your kidney journey with us today.
Thank you.
If anyone watching has additional questions for our speakers or about today's webinar that we were unable to get to, please email us at info@aakp.org, noting the webinar title in the email subject line. If you are not already a member of AAKP, we encourage you to join. AAKP offers free membership to patients and their family members, as well as living kidney donors. To become a free member, join online at aakp.org/join or by phone at 1-800-749-2257. To receive all the benefits of membership, please be sure to include your email address when signing up. As an AAKP member, you will be notified about all of AAKP's upcoming events, the latest in our educational program series, and when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the independent patient voice and change status quo kidney care. You will also receive a digital subscription to our bi-monthly magazine, AAKP Renal Life, and can select to receive any of our 5 different electronic newsletters, all for just signing up. We also invite you to check out our blog to read some great articles and patient profile stories, and follow us on social media for all the latest news and to keep up on what's trending. AAKP is dedicated to helping kidney patients across the disease spectrum understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and care partners. By visiting our website at aakp.org and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational resources and online tools to order or download free of charge, including titles such as Conversation Starter, Questions to Ask Your Healthcare Team About Choosing the Right Therapy for You, or the Coping, Living, and Thriving with Kidney Disease brochure. You can also order materials by phone. Are you a veteran or military family member? Join AAKP's Ambassadors Program to support our Veterans Health Initiative. AAKP ambassadors are vital to helping AAKP accomplish our mission and goals. Ambassadors engage in activities that impact policy and health outcomes, share their unique perspectives in surveys, focus groups, advisory boards, and other outreach opportunities. Ambassadors communicate with elected leaders and participate in congressional advocacy days to ensure kidney disease is a priority, and so much more. If you would like to become an AAKP ambassador, email us at ambassador@aakp.org. And finally, you can also visit our YouTube channel to watch a number of great presentations and webinars, all available on demand from our previously held events and programs. We would like to extend a heartfelt thank you to our webinar speakers, Dr. Paul Pileski and Candy Gatney, for graciously participating in today's HealthLine event. Their expertise, insights greatly enriched the discussion and provided valuable information. And thank you to everyone who joined us.